This is the Compassion Fatigue Resilience Part 1 Self-Regulation presentation. My name is Eliana Ramirez. I am the Associate Project Director of the Pacific Southwest MHTTC. And without further ado, it's really an honor and pleasure to introduce today's presenter, Mr. Joel D. Jackson. Mr. Jackson serves as a subject matter expert for several programs at the Chicago Center for HIV Elimination. Through Truth, Racial Healing, and Transformation of Greater Chicago, Joel serves as a racial healing practitioner. Joel co-facilitates racial healing circles across Chicagoland, helping to provide space for healing and connection, and to reaffirm the humanity in all of us. He is also the University of Chicago Medicine Assistant Director of Inclusion and Training for the Urban Health Institute Office of Diversity, Inclusion, and Equity. He coordinates the hospital's cultural competence training strategy and is the lead facilitator of the University of Chicago Medicine Cultural Competence course. Joel is also helping to coordinate the hospital's resilience-based care training strategy, which will include a focus on compassion fatigue, resilience, and a focus on trauma-informed care. He is a certified compassion fatigue professional and the 2020 Staff Diversity Leadership Award recipient for the University of Chicago. It is an honor and pleasure to welcome Mr. Joel Jackson.
Thank you, Eliana. Before I actually get started in the presentation, what I would like to do is invite you all to complete the Professional Quality of Life survey. If you downloaded handout number 2, that's the handout that you would use to complete the survey. There's about 30 questions, and I'm going to give you about maybe 5 to 7 minutes to complete it right now. So you can start on it right now as I continue to tell you a little bit more about the tool. Because some of this work is actually based on the ProQual, the Professional Quality of Life measurement tool, specifically to see if you are at risk from burnout and secondary traumatic stress. So let's talk about it just a little bit in terms of the definition of compassion. When we think about compassion fatigue, we have to define compassion as well. And compassion, the way I look at it, is stepping into someone else's suffering, or it's a state of sort of suffering with someone else as they are going through a state of suffering. So as you can see on the screen, compassion satisfaction, which is one of the measurements of the ProQual tool, looks at resilience and work satisfaction. It also measures your level of burnout, which is the level of negative effect that your work environment has upon you. And it measures secondary traumatic stress, which is the negative effects caused by your interaction with suffering in your patient care. So I invite all of you to complete the tool because this is helpful information for you. In fact, I will also invite you to complete the tool towards the end of the presentation, and then you'll also have access to a scoring sheet where you can actually score yourself and measure yourself and compare your levels before the presentation as well as after the presentation. All right, so our agenda, we are going to first go over objectives and norms. Then I'm going to go over a few definitions, invite you to watch a video where Dr. Frank Ochberg speaks about compassion fatigue and some of the signs and symptoms. Then we're going to go over a broad sort of definition of trauma, look at the effects of compassion fatigue, define self-regulation, and then actually I'll lead you in some self-regulation practices before we have questions and answers. And then after that, I'll invite you again to complete the ProQual tool at the end of the presentation and turn it over to Eliana for some final remarks and comments. So our objective, we're going to define secondary traumatic, further define secondary traumatic stress, burnout, and compassion fatigue. We're going to describe the physiological effects of compassion fatigue and describe and practice techniques for self-regulation. So our operating agreement uses this acronym of PRIDE. The P stands for participation, so I just ask that you do your best to eliminate distractions and stay present on the topic at hand. R is for respect, so I ask that you actively listen and trust the process. Stick with me until the end. I is for integrity, so I ask that if you hear something that does not vibe very well with you, you assume best intentions, meaning that I perhaps didn't intend to cause any harm, or if you see a comment in the chat box, assume that the individual did not intend to cause harm, and that can help with being able to move forward. D is for diversity, so I invite you to work on suspending judgment during the presentation. Judgment is something that we all do. We can't navigate through the world without judging differences. At the same time, when we have opportunities like this, we can use our filters, and I always say that what comes up in the head does not have to come out through the mouth. We can be intentional about what we say, or it doesn't have to come out in our typing. And then lastly, the E is for excellence, which I invite you to sort of gently lean into discomfort. Because when we're in our comfort zone, there's nothing pressing us to learn anything new. At the same time, during this session, you'll be receiving information, participating in activities, and broadening your awareness to stretch you away from your comfort zone. And the norms sort of provide a container around the experience so that no one feels fear or threat. Because when we do, we naturally retreat back to our comfort zone where no new learning can take place. Okay, so let's talk more about this, the definition of compassion fatigue. As you can see in the images, it says secondary traumatic stress plus burnout equals compassion fatigue. And secondary traumatic stress, the way I define it, it is emotional distress resulting from exposure to another person's trauma. So it's not necessarily the trauma that directly impacts me, but the stress that I experience or the traumatic stress that I experience from observing the trauma of someone else. Okay? In addition to that, we have burnout, which as you can see says the chronic condition of perceived demand outweighing perceived resources. So burnout, in a sense, is primarily a perceptual problem. It's not the external events that create burnout. It is whether we perceive the events as demands or threats, and we feel we have the resources or no resources or ways to manage the stress. It typically is gradual in that it happens over time, and it is often described as a general state of severe fatigue. It's oftentimes also hard for me to recognize in myself, so it may be easier for you to recognize in others than it would be for you to recognize in yourself. So at this point, I'm going to invite you to watch a video where Dr. Frank Ochberg talks about compassion fatigue and how we can develop compassion fatigue even though our work with suffering individuals could be rewarding. And he also explains some of the causes and symptoms of compassion fatigue. We won't watch the entire video, but you will be invited to watch about almost 5 minutes of the video and start back with the presentation in about 5 minutes. Well, essentially, for those of you who aren't able to watch it, what Dr. Ochberg does is he further sort of explains in his own words the definition of compassion fatigue and some of the signs and symptoms of compassion fatigue, and how even though the work that you may do or that we do is very much rewarding or self-rewarding, it still can take a toll on us and contribute to compassion fatigue because of feeling burned out or experiencing secondary traumatic stress from observing the trauma of someone else. It's important to also go over the many different types of trauma because many of the symptoms of secondary traumatic stress mirror the symptoms of trauma that individuals experience on a regular basis. In fact, studies show that about 68% of adults have PTSD or some forms of unresolved or untreated trauma. So when you look at this list, you see 6 different types of trauma that are defined. Historical trauma is sort of massive group trauma. So for example, the enslavement of Africans at the onset of this country, or even the genocide of Native Americans, which is specific sort of historical losses of population, land, family, and culture. Now, intergenerational trauma is very similar to historical trauma. People talk about historical trauma from sort of a communal perspective versus intergenerational trauma, which may be talked about more so in a family. The main difference is that it affects one family where legacies of loss occur. When we talk about acute trauma, examples of that could be a car accident, theft, witnessing a violent event, or an experience that threatens an individual's physical or emotional safety. It is commonly associated with post-traumatic stress disorder, or could even be associated with secondary traumatic stress, which often is the type of traumatic stress that impacts healthcare professionals. Examples of chronic trauma can include such things as domestic violence, childhood abuse, and war. Chronic trauma can even be made up from several instances of acute traumas happening one right after the other, after the other, after the other. Complex trauma, it commonly occurs with repeated trauma against a child. So, for example, sexual exploitation and trafficking, or adverse childhood experiences. Many of you may have heard of, I'm sure, the ACEs study, which are potentially traumatic events that can have negative, lasting effects on health and well-being. There are about 10 types of childhood trauma measured in the ACE study, and ACEs are linked to chronic health problems, mental illness, and substance misuse in adulthood. ACEs can also negatively impact education and job opportunities. At the same time, complex trauma is not just in reference to childhood trauma. Complex trauma can also occur as a result of adult experience of violence in the community. So for example, again, domestic and family violence, or even civil unrest, which is happening a lot in our country today, as well as war trauma or genocide. And that also includes refugee and asylum seeker trauma and extreme medical trauma and or re-traumatization, which is why becoming trauma-informed is so important. And then there are some common causes of system-induced trauma, which could be repeated, intensive, or humiliating interviews, foster placement, sibling separation, confrontations or visits with abusers, testifying in court, for example, or even invasive medical procedures. So when we think about secondary traumatic stress, it's also important to think the fact that traumatic stress in general can also be a factor in contributing to what we call compassion fatigue. And then I would also be remiss if I didn't also speak about racial trauma. Here you can see a list of names of individuals who have lost their lives due to a lot of civil unrest and racism in our country. And the last name on here is George Floyd, where because of a lot of the visibility of what happened to George Floyd in the media, which actually can be another example of secondary traumatic stress that an individual could have experienced from observing that footage, it still did not stop there. There are several other individuals who have been impacted that you may not have heard of. So, for example, Ahmaud Arbery, Tony McDade, who many people did not hear about because Tony McDade happens to have been a transgender man of color who also lost his life due to racism. But then we also have Rayshard Brooks, as well as Robert Blake, who is in critical condition. That's the most recent one that I became aware of, and that happened in Wisconsin. So consider secondary traumatic stress in addition to all of the many forms of trauma that we just discussed, in addition to racial trauma or other forms of trauma that people experience due to different forms of oppression. All of that included can contribute to these symptoms of compassion fatigue. When we think about what happened in 9/11, or when we think about what we see on the news, or when we think about the safety of our children, or when we think about a lot of the civil unrest and riots, the fact, though, remains from the CDC that we actually are the safest and the most frightened generation in the history of mankind. Studies actually show that humans are safer now than we've been at any time in history. Not only is there less violence now than at any time in history, but we have immunizations, we have wonder drugs, we have infrastructure, safe food supply, etc. And although we are safer than ever, we are also exposed to more trauma due to our interconnectivity. So television, radio, the internet, smartphones, social media, for example. The media gives us sort of a skewed view of the world, and we don't generally see the positive. Our fear comes from our learned history, and when something bad happens to us, we remember that and it affects our behavior. For example, if you worked with a physician who one time yelled and criticized you when you tried to use your voice or voice your opinion, you may have become very timid, afraid, or scared to even speak up. We acquire a learned history from all the things we are exposed to through the media as well. While we are experiencing much less trauma, we are witnessing more, and the effects are cumulative. So we learn to anticipate danger, and we can start to see danger even when there is none. So a lot of this is based on our lived history. If you were ever, for example, been in a parking garage, or when you look at this image, would you think of this image of a parking garage, if you were there, as a space where you would feel safe? This is a rhetorical question. You don't have to answer it out loud. But consider the whole notion of being alone in a parking garage that's not well lit, and how you may feel safe or not safe in that kind of situation. So this picture could be very scary for some of us. In fact, think about how you would feel if you were in this parking garage. For all of us who say that we may feel sort of unsafe, how many of us find ourselves on guard and worry when we go into a parking garage? Well, why is that? There are reasons for that. Maybe we have a past experience where something happened to us in a parking garage, or if we don't have an experience where something happened to us, it could be part of our learned history because we know someone else who maybe was assaulted or attacked or had reasons to fear being in the parking lot by themselves or parking garage. Or it could also be because of what we've seen on television, maybe in the news or even movies that often have settings in parking garages where bad or violent things occur. So then, how many times a day, this is another rhetorical question, how many times a day do you perceive threats? The answer is probably that you perceive threats a lot. How often during a day are your muscles probably tightened? Probably all the time. What happens in your body when you perceive this threat is that we experience muscle tension, we have increased heart rate, and it can even increase our blood pressure. So another rhetorical question, does your brain become more active or less active when you perceive threat? Well, that's actually a trick question because the answer is both. The brain actually changes. The brainstem, or basal ganglia, or thalamus, the more primitive structures in our brain, are activated under stress. This triggers sort of our fight or flight response. We may run, fight, have anger, and our muscles may feel tense. But the neocortex becomes less active. And as long as we stay in the context of perceived threat in our bodies, we continue to progressively lose neocortical functioning. So let's just recap what we're losing. The neocortex, part of the brain, is used for critical thinking, judgment, language, fine motor control, identity, empathy, compassion, impulse control, emotional regulation, and all of those things that are not necessary when being attacked by a tiger, for example. But they're very helpful when facing an angry family, when dealing with a suffering patient, when hearing a code being called, or even sharing a family's grief. So when interacting effectively with, it could also help for when interacting effectively with friends, with colleagues, with family outside the hospital as well. So the moral actually is that you are safe. As long as you right now in the moment are not in any immediate danger that could threaten you physically, you are actually safe. All right, so the idea is that what we see expressed as behavior is really only what's at the tip of the iceberg. But underneath the surface, as you can see, is a much larger mass of the iceberg, which represents our learned history, things that we experienced in our lifetime, and it's often largely in our subconscious, meaning we don't always think of these things as they may have an impact on our behavior. So that includes the trauma that we've experienced, that includes the secondary traumatic stress, that includes the things that we've observed in the media and television or on movies that give us the idea that danger is present or danger could be near because of our lived experience. So when we think about the perception of threat and how it can equal stress, looking at these images, stress and prolonged stress actually changes our brain. So these sort of scan images show some of the physiological effects of stress. In states of high anxiety, there is increased basal ganglia, amygdala, and hypothalamic activity. So note the pink areas on these images. This demonstrates how the parts of our brain that trigger our emotions from our painful past, our learned history, actually can affect us physiologically. So then, when we think about perceived threat, these are some of the things that happen to us physiologically as well as within our brain mechanics. When we're in a constant state of perceived threat, our sympathetic nervous system is always activated. As you can see, our heart rate and blood pressure go up. We breathe faster, but not as deeply, so our breathing volume goes down. There is an increase in muscle tension, and we are in a state of dis-ease, which isn't a coincidence that this is the same word as disease. But compassion fatigue is not a disease. It does cause dis-ease within our body, if you will. So take a look at the brain mechanics and the effects on our thinking process. Stress alters our ability to problem solve, make decisions, or remember and to communicate verbally. We become very reactive. And note that obsession and compulsion also increases. We're focused on the threat or source of stress, but strength and agility decrease. What do you think the long-term effects of stress are when our thinking abilities are affected? Well, we react rather than think clearly, and we are prone to making mistakes. We become sort of reactive and less proactive. What we're doing if we're living in this constant state of perceived threat is allowing sort of our bodies to continue in our threat response. It's like gunning the engine of a car. If you had to drive 5 hours in a car and you gunned the engine the whole way, that car would probably break down somewhere on the side of the road, right? And it may not even make it. Sometimes that's what we're doing with our bodies when we continue to push forward, expecting that it's a part of our work and a part of our job or a part of the status quo, and we're gunning our engine without giving ourselves or our bodies an opportunity to rest or relax. And in this constant state of perceived threat, we are in sort of a hyper-arousal state. So these are some of the typical healthcare provider suffering from some of the typical symptoms of a healthcare provider suffering from compassion fatigue. So here you can see in the workplace, we experience fatigue, we're often nervous, can have increased sick days, we may be more cynical and pessimistic, we can have a loss of self-esteem, it can direct our anger towards coworkers, we may dread going to work, or even often feel like quitting our job. At home, some of the impacts are we could experience sleeplessness. We may have a loss of interest in sexual activities or social events. It could change our appetite. It can cause us to have weight loss or weight gain. We may have relational problems or even have nightmares about work experiences or past experiences related to work. So, self-regulation, as you see here, is when we can shift from being sympathetically aroused or having that fast heart rate, muscle tension, breathing fast, feeling scared, which is hard, makes it hard for us to think clearly. So the first and most important step when it comes to compassion, fatigue, resilience will always be self-regulation. In fact, as we were experiencing these technical difficulties, I was practicing some of my self-regulation techniques to help me regain that neocortical functioning to problem solve and think about what I could do in the moment to help continue in being effective at giving this presentation. Just to give you an example, I promise you I didn't do that on purpose. So as we talk about perceived threat, look at what happens when we practice self-regulation. Physiologically, we have perhaps a stabilized heart rate, stable breathing, balanced circulation, and you can see all the others. With brain mechanics, there's no threat response, so that part of our brain, that neocortical functioning, is enhanced and it increases. It also allows us to become more creative and more intentional or proactive with our behavior, and we have pro-social behaviors. As leaders, we become less coercive and we become more transformative. Now notice at the top of the screen it says perceived threat plus self-regulation, which means that we're not necessarily eliminating the aspect of perceived threat. What we're actually doing is self-regulating so that we can sort of manage the stress that we're experiencing, because stress is inevitable. And sometimes secondary traumatic stress and traumatic stress or racial trauma or any of the forms of trauma we experience are inevitable, but we can manage it and mitigate it by practicing self-regulation. So going back to the analogy of driving the car 4 hours on a highway, self-regulation is like taking our foot off of the gas pedal or even pumping the brakes just a bit to give the car an opportunity to recalibrate its engine. Self-regulation allows us to recalibrate our body. It allows us to shift from what's called a sympathetically dominant nervous system to more of a parasympathetic dominant nervous system. And again, regaining all of these effects in brain mechanics, physiologically, as well as other effects. So, self-regulation is a resilience technique, and it's about developing bodyfulness, which you may not find in Webster's dictionary, but I think you get the idea behind it. It's all about figuring out ways to help your body to sort of chill. And these are sort of intrapersonal skills to practice for the purposes of self-regulation. So let's practice a couple of these techniques together. So this method was originally developed actually by the United States military. What I want you to do is find a spot at eye level, maybe 5 to 10 feet in front of you. And as you find that spot, I want you to notice your vision. Notice your clear vision to that site or to that spot that's in front of you. Now focus your eyes for 5 seconds on that spot. 5, 4, 3, 2, 1. Now try to soften your focus until the spot becomes blurry and hold for another 5 seconds. 5, 4, 3, 2, 1. Now try to shift your focus until try to shift your focus to your peripheral vision. Do this with both eyes. And if you have a problem or trouble shifting from focusing on the spot in front of you to your peripheral vision, maybe take your hand and stretch your arms out. But still keep your gaze forward. Wiggle your fingers so that you can begin to see everything in your peripheral vision. And as you maintain peripheral focus for about 10 seconds, you should note relaxation in your body. Let's try this and count to 5. 5, 4, 3, 2, 1. What's happening is you are practicing at self-regulation. I'll speak more about this in session 2 or part 2 next week. But what we have is what's called the vagus nerve that goes from our brain all the way down to our pelvic floor. These techniques in self-regulation are actually helping us to relax the vagus nerve. Because when we physiologically can relax our vagus nerve, we automatically within seconds move from a sympathetic dominant nervous system to a parasympathetic dominant nervous system and can then regain that neocortical functioning that tends to be lost at moments of high levels of stress, secondary traumatic stress or other forms of traumatic stress. So let's try to practice another technique. For this one, some of these exercises work better for some than for others. That's why I'm going to share with you about 3 today. And because self-regulation is the most important, I'll share new self-regulation exercises towards the beginning of each presentation at part 2 and at part 3 as well. So the purpose of practicing several is so that you can try to identify which ones may work best for you. Okay? So with this next self-regulation activity, again, we're going to practice relaxing the body so that we can relax our mind. So what I want you to do is a quick body scan from head to toe and include your back. And I'll walk you through this. You know, maybe first plant your feet firmly on the floor if you're seated. And I also invite you to close your eyes. And if you're not comfortable closing your eyes, maybe try to find another focal point, maybe the same one you did with the peripheral vision exercise, just about 5 to 10 feet in front of you. And then do your body scan and begin to relax those muscles in your body. So let's start with the head. First, relaxing the muscles in your face, relaxing your forehead, relaxing your brow, relaxing your cheekbones and your jawline. Allow your tongue to fall from the roof of your mouth to rest snugly at the floor of your mouth. Moving down to the neck. And you may need to roll your neck around just a bit, just to notice which muscles may be experiencing tension. And after you roll your neck around, just allow those muscles to relax. Move down now to the shoulders. We tend to hold a lot of tension in our shoulders. You may need to roll your shoulders forward a bit, or even roll your shoulders back just a bit, and then just let your shoulders sink at the sides of your body. Relax all of the muscles in your arms as well. Maybe even taking your hands and balling up your hands into fists and then releasing them and letting your hands relax on your knees. Let's go to the front of the body. Relax all the muscles in the front of your body as well. Relaxing your chest, relaxing your torso and your belly. And if you're like me and you like to hold your belly muscles in, try relaxing them and just let them release. Let's not forget our back. Relaxing all of the muscles in your back as well. Following your spinal cord. Going down from your neck all the way to the pelvic floor. And because the vagus nerve goes all the way to the pelvic floor, begin to try to relax all of the muscles in your pelvic region as well. You can relax your back and your pelvic region if you have a backrest Just allow yourself to sit back in your seat. And then for the pelvic floor, imagine you sort of have a square plane in your pelvic floor. And imagine those muscles just sort of widening or spreading. And just allow your body to sink in your seat. Relax all the muscles in your legs as well. Relaxing your thighs all the way down to your knees. Relaxing your calves. Relaxing your ankles. Even going to your feet and your toes. If you have to curl your toes up just a bit and let them go and release, you can do that as well. And what I want you to do is for 5 seconds, become like a wet noodle and just allow your body to sort of slump and sit for 5 seconds. In 5, 4, 3, 2, 1. Now consider how you felt before we practiced this self-regulation exercise and how you feel now. Hopefully you feel much more relaxed. In addition, you may have also experienced some intrusive thoughts while you were listening to my words, and that's fine because that's perfectly normal. Hopefully, after practicing self-regulation, you are able to focus a bit more on the words that I'm saying as you're listening to the presentation. Okay, let's try one more self-regulation exercise. This one is called diaphragmatic breathing. And I'm going to lead you in 5 cycles of diaphragmatic breathing. First, I invite you to put one of your hands on your chest and put your other hand just beneath your rib cage on your diaphragm. Now begin to pay attention to your breathing and notice your hands rising and falling as you begin and continue to breathe. What I want you to do is start breathing in through your nose and out through your mouth. And I'm going to walk you through 5 cycles where I want you to breathe in through your nose for 3 seconds, and then you'll breathe out through your mouth with pursed lips for 5 seconds. Okay? Let's begin. Breathe in through the nose, 1, 2, 3, and out through the mouth with pursed lips, 1, 2, 3, 4, 5. Breathe in and out. Breathe in and out. Breathe in and out. One more time. Breathe in and out. Good job. Now notice it may have taken a few minutes for me to walk you through these exercises, but when you practice them on your own, you actually will only take seconds to do them, whether you do the peripheral vision exercise or the wet noodle exercise or the diaphragmatic breathing exercise. You can practice these self-regulation techniques at any point throughout your day. You can even practice them while you are in the middle of sessions or at work. And like I said, I've been practicing self-regulation throughout this presentation. Something you may not know about me is that I used to be extremely nervous about speaking in public. Well, after learning how to practice self-regulation, I still get nervous, but it helps me to be more focused, and it helps me to sort of self-regulate, so I move from my sympathetic dominant nervous system to more of a parasympathetic dominant nervous system. In fact, I encourage you to practice self-regulation perhaps every 15 minutes, or every 30 minutes, or maybe every hour on the hour. Thank you, Betty. At least try to practice self-regulation a couple of times throughout your day so that you can move from pressing forward out of a threat response to being more self-regulated so that you may still have perceived threat, but then you can shift to the parasympathetic dominant nervous system. Now, if you think that maybe these techniques are kind of difficult, or you may not be able to find time to practice these techniques while you're at work or even while you're at home because of so many competing priorities, I want you to look at the images that you see on the screen. The posture that you see these individuals have actually helps to stimulate diaphragmatic breathing. I was taking a walk with a colleague just yesterday and noticed that I was starting to get tired, and this is some posture that some joggers use also when they're trying to catch their breath. So if you lock your hands and put them behind your head, you will notice that it's causing you to breathe more from your diaphragm, where you're taking deeper breaths and your lungs are filling more with air, so that you are actually augmenting diaphragmatic breathing. Now, culturally speaking, this may not be something that's acceptable as a norm within the workplace, but that's something that we can try to shift and change, especially if we teach this technique to others. So if at any point throughout your day you cannot practice the wet noodle exercise or the peripheral vision exercise or even the diaphragmatic breathing exercise, just lock your hands and put them behind your head for a few seconds. And that will help you to breathe from your diaphragm and hence help to relax the vagus nerve and help you to self-regulate. So I have this image just to sort of bring home the fact that what we're trying to do is shift from having our minds filled with a lot of clutter, with a lot of competing priorities, with a lot of worries, or with a lot of stressors, to being more like the little pup in the image of being more mindful and having more clearer focus on the present moment. I would be remiss if I didn't also speak about the CLARA method, because there are connections to practicing self-regulation and actually being able to use the CLARA method. If you attended one of the previous sessions on cross-cultural communication where I talked about the CLARA method, self-regulation is actually the technique that we can use for the most important and very first step of the CLARA method. Self-regulation helps us to calm ourselves, to find our center, or check your pulse, take a deep breath, whatever it is that you need to do. Because when you do that, you move from a sympathetic dominant nervous system, again, to a parasympathetic dominant nervous system, and regain that neocortical functioning that actually helps to problem solve, that helps us to tap into compassion, that helps us to think of consequences of our action, and it helps us to be able to speak more clearly and have more control of the language that we use. Helps us to be, again, more proactive and less reactive, more transformative and less coercive. And then, after we find our center, then it's easier to listen actively to the other person's perception of the problem, whatever the issue is or whatever is going on for that other person. And we're listening to the words that are spoken as well as the words that are not spoken so that we can affirm some component of the speaker's perspective. Again, Gandhi once said that we all hold a piece of the truth. So when we're affirming, we're actually trying to affirm a piece of the other person's humanity. We're not necessarily trying to agree with the person. It's easy for me to affirm you when I agree with you. It may be a little more difficult for me to affirm you when I disagree with you, which is why it's important to practice self-regulation, find your center, listen to the words spoken and unspoken so that you can maybe affirm a piece of that other person's humanity, which may just mean affirming the emotion that that person is experiencing at that moment. And we do these first three steps before we respond to what was said and add information to the response in a way that moves the discussion forward. Don't forget that it's important to not use the word but or fancy buts, or fancy buts like however, that said, or nevertheless, and try to replace them with connectors like and, in addition, also, or at the same time. And if you plan to join us next week, what I invite you to do is practice these self-regulation techniques. I wanted to give you another opportunity to complete the professional quality of life scale or the tool now that we're at the end of the Compassion Fatigue Part 1, Compassion Fatigue Resilience Part 1 on self-regulation. You can actually access it. It's free on the internet. If you Google ProQual, it will pull up a lot of information about the professional quality of life measurement tool, how well sort of you're doing when it comes to compassion fatigue. It's personally informative for you. Now, if your organization decides to start a compassion fatigue resilience initiative, you could even include using the ProQual tool in an effort for quality assurance, so that it's not research, but it helps you to gauge how well you will be doing within the initiative. You could also use it for research purposes, but then you would have to go, of course, through the IRB process.
Thank you so much, Joel. I am absolutely certain, based on the comments that I'm seeing from people, that I am one of many on this call who are deeply appreciative of not only the content that you just shared with us, but the way that you shared the content. If you've missed a previous webinar, as you heard from Joel, he's done several really great webinars for us about cultural competence and cross-cultural communication. Those webinars, as well as a variety of other webinars, are available for free on our website at no cost. And there is an optional continuing education hours for mental health professionals. If you would like to get the CEHs, they are available 1.5 hours. For ASWs, nurses, LCSWs, LEPs, LMFTs, LPCCs, and or PPSs, as required by California Association of Marriage and Family Therapists. And I can tell you, as a licensed social worker in the state of Ohio, but I live in California, if you are connecting with us outside of the state of California and you're looking for CEs, go ahead and get our CEs, and you just check with the licensing board with which your license is located. Oftentimes they will do, they'll take the CEs from another state. Please do connect with us via email, phone, website, and we're also on social media, Twitter, Facebook. And finally, thank you so much for attending today. And thank you to SAMHSA also for funding this.